What are some of the biggest misconceptions about women with fibroids?
Heavy bleeding is common.
What made you guys decide to bring together different specialties?
We really look at this as collaborative care. It helps out for better outcomes.
Risk factors, what to expect, how the procedure works.
Usually how the process would go, is how do you get diagnosed? What is the route in order to look at uterine fibroid embolization? What kind of fibroids can this treat?
What do you hope that every attendee walks away with by attending this event?
I really hope that women just feel empowered.
Remind everyone, when is this event?
It's August 19th at 12:30 p.m. Central Standard Time.
Hi, everybody. This is Rachel Biesinger with Patient Pro Marketing with the OBL ASC Marketing Blueprint. Today is going to be a little bit different. We're going to be previewing a really exciting virtual event that's focused entirely on women's health. On August 19th at 12:30 p.m., the North Star Fibroid Clinic will be hosting the Women's Wellness Forum, talking specifically about understanding fibroids and your treatment options. This virtual event is free. It brings together experts from interventional radiology, gynecology, and pelvic floor physical therapy to help women better understand fibroids and the treatment options that are available today. Joining me today is my good friend Gabby, one of the physician liaisons there at North Star Fibroid Clinic, to give us a preview of what attendees can expect. Thanks for joining me today, Gabby. So excited to see you.
Thank you, Rachel. I'm so happy to be here and sharing this. I'm so excited for this fibroid panel and having access for options for women in general.
Yeah. So real quick, just tell us, where is North Star Fibroid Clinic so everyone knows?
Yeah, so we're located here in Golden Valley, Minnesota, which is a suburb right outside of Minneapolis. We have a beautiful view of a golf course over here. It's super open space and it's a great OBL setting.
That's awesome. So what I like about this event is it's not just for people in that Golden Valley, right? This is
correct.
This is nationwide that you guys are offering this.
We're opening this up. So our providers here are within the Twin Cities area. However, we have so many people that travel within the country and even internationally for treatment, looking at all extensive treatment options, whether, they're looking at alternatives to surgery, minimally invasive, or maybe just knowledge as a whole. So super exciting.
Yeah, I know your doctors are very well known globally, right? Dr. 𝐸𝐭𝐳, Dr. Astani are in France all the time, in Japan, and all over the world. So tell us specifically, let's talk about this event because I'm really excited to share it with everyone. What inspired North Star to create the Women's Wellness Forum to begin with?
So both Dr. Astani and Dr. 𝐸𝐭𝐳 are really big about education. And so that was the biggest thing that we wanted, was for women to have an educational piece about fibroids as a whole, but then also to have all extensive treatment options so they feel better informed. We genuinely feel like knowledge is power, and we think that that's super powerful. And honestly, just the advocacy side, we want women to feel empowered to be able to know knowledge before maybe going into an evaluation or an appointment, and knowing just an entire scope, either of their diagnosis and treatment options. So education was the biggest backbone to why we wanted to have this wellness forum for women.
That's awesome. And I agree with you 100%. Tell people out there, what are some of the biggest misconceptions about women with fibroids?
The biggest one is that heavy bleeding is common. We come across a lot of women who call in, are telling us symptoms. Heavy bleeding is probably the biggest one. And the second is that surgery is the only option. They're thinking, okay, I'm being told this is surgery. I'm trying to find something else, but maybe that is only my option. And lastly, too, fertility concerns. When we hear about fibroids, some women think that means that they're infertile, but that isn't always the case. And so that's why we're able to have this panel as an educational to kind of dive into these misconceptions and have the experts give more detail to this.
What made you guys decide to bring together different specialties for this, right? Like your doctors specifically are vascular and interventional radiologists, but you're going to have gynecologists, you're going to have pelvic floor therapists. What was the thought process between like up to bring everyone together and collaborate?
Yeah. So a lot of the times I think that in the healthcare system, people look at the different specialties as competitors, whereas we really look at this as collaborative care. We know with multidisciplinary, it helps out for better outcomes for women, especially with their quality of life, and then also just what their goals are being met. So when we created this panel, we thought, okay, we know that there's different patient cases, different outcomes and goals that women are having. So if we have an entire panel, we can get down to answering more in-depth questions that maybe they wouldn't have thought of at the time in evaluation, or they've done research and they're thinking this is so overwhelming because of the internet. So let's just have this panel and have a collaborative front that firmly believes that there's need for minimally invasive, need for the PT route and non-invasive, and then when we look at an intervention of surgery.
I think what I like about this platform and your different specialties is super unique, right? Because you and I are kind of in this one lane, right? Where we're
Right.
like minimally invasive, uterine fibroid embolization. It's not always one size fits all. It's not always,
Yeah.
yes, this is the end all be all option for every patient.
Mhm.
Some people, like you said, might have other conditions, or it might be too serious or too big of fibroids, or in a location that UFI wouldn't necessarily work. So I
Right.
think hearing all the different perspectives from these providers is going to be really, really interesting. The pelvic floor specialist, to me, I don't feel like a lot of people know about that. So I want to kind of
Yeah.
go through the panel just to learn who they are and kind of like what people can expect from
Yeah.
each expert, right? The SMEs
Sure.
of the panel. So let's start with your boss, right? Let's talk with Dr. Astani. Tell
Yeah.
us, what does Dr. Astani specifically bring to this discussion?
You know, Dr. Astani, he brings an entire different side of patient care, in my opinion. Obviously, I have the privilege to work alongside him, which has been incredible, but I've also been able to see how an interventional radiologist and bedside manner is really in depth with him. He really genuinely cares about what is happening with a patient, their concerns, hearing their story, and really trying to figure out what is the best route of treatment. You know, he's come across, I would say, patients that maybe don't fit criteria for what he can offer. So then he thinks, okay, within my scope of research and my medical background, where can we now send this patient to be adequately taken care of? He is so knowledgeable and so great at presenting on the medical side, but seeing just his compassionate heart with women who are really struggling, it goes such a long way.
I've had the honor of seeing Dr. Stani present at some of these national global meetings. When he speaks, it's very genuine, right? It's authentic and
Sure.
genuine. It's not scripted. It's not like he's reading a slide because he has to be here and then he can't wait to get on the flight to go home. Like, he truly cares. And you see
Yeah.
him in the hallway stop each other physician and ask them how they're doing and what are they doing and how are they treating patients. So it's
Mhm.
more than like, of course, the patient care is always number one, and that's what we love to see the
Right.
best. But he also wants to inform other providers how to
Mhm.
do these things and how to treat patients and do it right. What can we expect while he's on the panel, like to discuss regarding minimally invasive treatments for fibroids?
Yeah. So Dr. Astani, obviously, he's an interventional radiologist, very specialized within uterine fibroid embolization as a whole. So he's a major advocate for the minimally invasive treatment option. Preserving the uterus is a big deal, and really trying to enhance, I would say, a type of treatment that has little to no downtime for women as a whole. I think he's really going to want to expand, but I know he's going to hit on touch points of why the other two pillars that are here are still needed in collaboration. You know, we've been able to help treat patients together, which makes this even, you know, just like a closer knit group of us that are going to be together. And I think that that's really something to be pride and know that we're helping women in alternatives that maybe he can't offer or treat.
Yeah, I think that's great. UFE, uterine fibroid embolization, is probably going to be option that he discuss in detail. Will he be going over like risk factors, what to expect, how the procedure works? Like some would have no clue, right? They hear
Yeah.
UFE procedure and they don't even know.
Definitely. Usually how the process would go, you know, is how do you get diagnosed? Then what is the route in order to look at uterine fibroid fibroid embolization? What kind of fibroids can this treat? How does treatment go hand in hand? The outpatient experience, which is different too. And then also just the little to no downtime in recovery, which women, we warrior on. Unfortunately, we provide and give to a lot of other people. And he wants to make sure that we stay on our quality of life, especially with the women who come in that are struggling. That's a big thing that he really wants to help come and take it home, is he wants to make sure that women feel like they're being heard and their quality of life is enhanced.
I think that right there is going to resonate with a lot of women, right? Like,
too.
they just don't listen. Like, the doctors don't listen. They feel like it's in one ear and out the other, right? So I'm super excited for him to speak. Now let's talk about your gynecologist on the panel. That's Dr. Catherine Grant, correct?
Yes, Catherine Grant.
Okay, so tell us a little bit about the important position for her to be on the panel, and then how, I guess, kind of real quickly, the two of them working together.
Absolutely. So Dr. Grant, it's been so nice to have her involved in this whole entire process, because gynecology is extremely important. A lot of us women, when we have heavy bleeding or fertility concerns, or, we're looking at pelvic pain, we want to go to a gynecologist. That's usually after a primary stop. That's the next go-to. And so she is a first kind of specialist that would be seeing women who are going through these symptoms, and then being able to get a diagnosis, imaging needs, and really a proper treatment plan. So I kind of look at it as like Dr. Grant's kind of the QB behind this within the women's specialty side, when we're having these types of concerns and women are looking for help. So that, I would say, is the biggest thing with Dr. Grant, having that gynecology collaborative side of this. And what's super cool about having both IR and gynecology on the panel is that they're looking at a co-collaborative and can actually discuss in some patient options of, I think that this is minimally invasive. The patient's really looking at this. Try and take a look to see if those fibroids would be able to shrink using minimally invasive. She has a background of laparoscopic and robotic surgical techniques. So she wants to make this, an easier, pleasant, more experience for women too. But she wants to have knowledge to be able to see, could this be a minimally invasive option, or is the surgical side the best route for the patient? So having both of them together, that's going to be a really strong discussion.
Yeah, I think personally, when I log in, because of course I want to attend your event, I think I would like to ask her a question. Most patients don't know what to ask their OBs, right? Or their gynecologists. So they come in with these symptoms. They don't know, how do you get the physician to think about the minimally invasive options, or even push them towards could this be an option for me or not? Some doctors, again, narrow-minded or tunnel, right? A doctor told me we play with the tools in our toolbox. So they're not used to, a gynecologist typically isn't going to think of IR procedures and that sort of thing most of the time. So I'm excited for her to share with women who may have symptoms, don't know how to approach their doctors, right? Sometimes you're scared to challenge your physician because you feel like, I don't know, they're going to think you're Googling and you're thinking the worst of everything. But I'm excited to hear what she has to say for people.
And I think they both agreed too that not one treatment fits all fibroids. So we have to really hear out what the end goal is for our patients and then navigate that. It was a really great experience for Dr. Grant to come here and meet our team and observe a uterine fibroid embolization treatment. And one of the biggest things in discussion was she only sees IR in the hospital. So what does outpatient IR look like? Mm-hmm. So it was a really great experience.
I bet. That's so different. I bet. And then seeing the patients afterwards, right? And hey, you get to go home, and what a pleasant experience. It was like being at the spa all day. Okay, so let's talk about Kelsey Nowak. She's your physical therapist, right? That, again, I said it earlier, most women don't realize that pelvic floor therapy could help or be part of this journey. So how is she included? Tell us kind of I feel like she might be like the cream on top of the cake. I don't know how I'm excited to hear what you have to say about it.
Yeah. So honestly, I look at Kelsey because fibroid care is beyond the surgical or minimally invasive side. And so to have somebody that has an entire background and, practice of her own now that's built on just pelvic PT health, she goes extensive into her type of trade. Kelsey has the highest tier of certification and licensing in pelvic PT. And so she is definitely a pillar that a lot of women don't know about. Sometimes she'll, I guess, pelvic PT, you hear about it maybe post-pregnancy, but she spans entirely around pelvic pain, urinary frequency symptoms, cramping and discomfort, fibroid care, pain with intercourse. I know I'm forgetting a plethora of treatment that she can help with and conditions because her background is so extensive. So I look at her as she is definitely a powerful tool for women, men. We all have a pelvic floor to use, but I think finding out where she fits into each of these specialty care and how she can help boost the quality of life side, it's great. I'm really excited for her to join the panel with these two specialists too.
Have you guys at North Star Fibroid Clinic actually sent patients post UFE to Kelsey,
Yes.
or is it before?
So we typically find that she's doing a workup and evaluation for someone that might be having pelvic congestion syndrome or has been diagnosed with uterine fibroids, or they're coming with a plethora of, additional symptoms that she's able to help treat. So then she's thinking, okay, we've been doing these types of, PT. Let's take a deeper dive. Let's look at an imaging. Let's go in for a consult and let's figure out what's going on more internally than what I'm able to see and justify. And then it's this collaborative. Great. Okay, so we did the imaging. We can tell that this is actually going on deeper within the pelvic floor. This is the treatment. And then we go hand off back to her on that post UFE treatment, post hysterectomy, if that's needed, post myomectomy. So she fits in a niche usually before treatment and then also afterwards.
Interesting. Yeah. I'm really excited to learn more about that. Okay. So tell this event, tell us who should attend. Who are we inviting?
Honestly, any woman who has a uterus, has been diagnosed with fibroids. Maybe it's a friend who's been diagnosed with the fibroids, and really anybody who's just wanting to learn more. I think it's super great that you're going to be in front of 3 different specialties, which is not very common at all within one type of condition. So just being able to ask those questions that maybe you might not have thought of at an evaluation, or you're just starting some research and you want to deep dive and ask more in depth than what you're finding on Reddit or, something else online.
Yeah, that was going to be a question. Can people ask questions during the event?
Yes. So I'll be able to interview and do a couple questions. Let's go over the gist of what are fibroids, cover a couple bases, and then really opening it up to the audience and saying, this is your time to be able to ask these 3. Go for it.
Yeah, I think it's great that, like you said, you don't have to make 3 different doctor's office appointments, not 3 separate copays. You literally have all the experts right there, right at your fingertips. And one, you'll get to listen prior, right? You may not even have to ask the question. You might have it written down, but by the time you interview each provider, they could hit those questions. What do you hope that every attendee walks away with by attending this event?
I really hope that women just feel empowered and that they know that they're not alone in this journey. We get told that a lot, that women feel like this isolation because of the fibroids and what it's doing to their quality of life. Not being able to go to their kids' sporting events because of pelvic pain, or, difficulty with a partner, or also feeling scared and concerned about childbearing later on. So we want women to know that there is treatment options for everybody. Feel empowered to ask the difficult questions to these 3. They're ready to go. They've seen it. And also just knowing that with multiple specialties, it allows for better quality of care. So I think those are probably the biggest things that we want people to take away from the education, empowerment, knowing you have options.
Okay, great. Remind everyone, when is this event?
It's August 19th at 12:30 p.m. Central Standard Time.
Okay, and it's free registration. How do people register for this?
So there's a webinar link. It's on our landing page for a fibroid clinic, but we can go ahead and post the link in here too. It'll be via Zoom, so you don't need to download anything. It's just a link that you can go ahead and click on, and then you're inside the panel.
Okay, awesome. We'll make sure we post a QR code, because you said also, if you can't make this, you have a support group, correct?
That's the other thing I was going to say. So we have a Minnesota fibroid support group that's here within locally, and we posted that too. too, just because it talks about all sorts of treatment options. We have a lot of women that actually talk about some symptoms, but also, within the local Twin Cities area, the state fair is coming up. So, people end up putting stuff out there about just community engagement, which is always fun too, but really surrounding with people that are going through fibroid diagnosis and looking at treatment alternatives.
Okay, awesome. So, Gabby, any final encouragement or words for any women who have been putting off treatment?
Yeah. I said it earlier, as women, we warrior on. And at this point, women deserve to be able to have answers to treatment options. Really, we want the engagement to be of a place where we can have open conversation. There isn't one treatment that's going to be better than the other. This is where collaborative and multidisciplinary care matters, and women deserve that.
Okay, well, I know I'm really excited. We'll make sure that we post the links in here, your website, support groups through Facebook, I assume.
Yes.
Okay, awesome. So everybody watching this, whether you're already been diagnosed with fibroids or suspect that something isn't quite right, or simply you just want to know what your options are, the Women's Wellness Forum will be an opportunity for you to hear directly from the experts. Multiple different specialties too. So super excited for that. Once in a lifetime type of thing. Again, the event is on Wednesday, August 19th, 12:30 Central. We'll post the QR code here. You can scan it. It'll be a Zoom link. Gabby and her team will send it to you. Again, Gabby, thank you so much for being here with me today. I look forward to seeing you guys on the 19th.
Thank you for having me. We're excited.
Thank you.